If a patient would like to send a secure message through the patient portal, they will click the Messages menu after logging in. On the Messages page, to the left in the navigation pane, we modified the text for the options to send a message. Patients have always had two options when sending messages, but we found that they were confused as to which one to use, so we modified the description text to be more straightforward. If the patient wants to send a message to one of your doctors, they should select the option labeled Send a Message to Our Practice. This will then prompt them to select a message type. After selecting the type of message, they will receive this dialog. This dialog will be the same for every message type. They will first select the provider that they normally see. This provider and any other provider who has documented an encounter for this patient during the reporting period will receive credit for the meaningful use measure. The patient will then enter their contact information and message, then click Send. If they want to send a message to a physician not in your practice, they should select Send a Message to a Provider in Another Practice. This will take them to a completely different screen, which will allow them to send a message using a direct address. Previously, this option was labeled Send a Direct Message. It is the same functionality as before, just renamed. If the patient would like to send a direct message, they'll start by clicking the lookup icon next to the To field. Then enter the search criteria for the provider they are looking for and click Search. Once the results are returned, they can highlight the provider and click OK to select them. They can then enter their subject and message. They can also attach clinical summaries or lab reports or other health information by clicking the drop-down next to the corresponding field and selecting the appropriate date. Other health information would be scanned documents that were sent to the portal. Once they're ready, they can click Send. The message is then sent, and you will receive a successful message on this page.